to the iCANX talks so that we can connect the world and the universe and with everyone all over the world. So I'm Professor Miso Kim, an assistant professor from Sungkyunan University, South Korea. I'll be your moderator for tonight. And for August, we already have Professor Tia Lee from Shanghai Institute of Microsystem and Information Technology. And today we are going to have a great speaker, Professor Dae-Hyeong Kim from Seoul National University, South Korea. And so please stay with us. And next week, you're going to meet Professor C. Decker from Delft University of Technology. And the following week, you will meet Professor Gui Lulong from Tsinghua University. So stay with us for the rest of the month again. And today, we're going to have Professor Dae-Hyeong Kim as our speaker, and I'll be your moderator. And we will introduce Professor Xing Xiang from Tsinghua University and Professor Yu Ching Chong from Peking University as our panelist after Professor Kim's talk. So let me introduce Professor Dae-Hyeong Kim from Seoul National University. So he got his bachelor's and master's degree at Seoul National University, Korea. And then he got his PhD from University of Illinois at Urbana-Champaign. And then he did some postdoc, and he started his professor career at Seoul National University, one of the top university in Korea, in 2011. And he became a great, famous researcher in Korea, in all over the world. And he will share he got so not need to say, but he received so many awards. And he's also leading the IBS, which is the Center for Nanoparticle Research of Institute of Basic Science, which is called IBS in Korea, which is a very big group, very big research project. And he received so much award, and he will share today his research with the title of Nanomaterials-based soft bioelectronics and its application to cardiovascular disease. So let's welcome Professor Kim with your warm heart. So Professor Kim, the stage is yours.
Thank you very much. Let me share my slide first. Can you see my slide? Okay, that's great.
Yes, very beautifully.
Yeah. First of all, thank you for kind invitation, giving me this nice opportunity to share our recent research results about the nanomaterials-based soft bioelectronics and its application to cardiovascular disease. We have been working on the nanomaterial synthesis and application to soft bioelectronic devices, and it has been utilized in many different types of disease, from brain disease to cardiovascular disease. But today, I will particularly focus on the application of the soft bioelectronics for cardiovascular disease. Yeah. Okay, let me begin with statistics about heart disease. Just a second. Yeah. This chart shows the number of deaths between 1969 and 2020 in United States. As you can see, the red bar corresponds to heart disease deaths, entire heart disease deaths, and the blue bar corresponds to entire cancer deaths. And as you can see, historically, heart disease deaths has been number one cause of death. Almost 25% of people are dying because of the heart disease. And in recently, the number of the heart disease deaths is quite similar with the cancer deaths, but still, it is true that heart disease is a major cause of deaths in the United States. So because of this, we are very interested in the development of novel soft bioelectronic device to treat cardiovascular disease properly. And if we take a look at the statistics in more detail, among the entire heart disease deaths, almost 70% of the heart disease deaths is related with the coronary heart disease, coronary heart artery disease. And in the case of coronary artery disease, the device is very important to manage the coronary heart artery disease. So that's the reason why we are developing a novel soft bioelectronic device to treat the coronary heart disease. So today, I'm going to share our previous efforts for the soft bioelectronic device for cardiovascular disease from the monitoring device, wearable time monitoring device, to the implantable interventional device. So let me begin with the wearable type monitoring device. Actually, there is a commercialized device to monitor EKG heart rhythm, which is called as a Holter monitor. And let's watch a movie made by National Heart Center Singapore that explains Holter monitoring test.
The test uses a wearable device to record the ECG signal. Compared to the usual ECG test, which can only see the electrical activity of the heart for a short period, a Holter test is able to record for a continuous long period. This allows more time for any abnormalities to be picked up, especially those that occur for short periods or do not occur during the typical ECG test.
So the key difference between the conventional ECG test and the Holter monitoring test is the time duration. In the case of conventional ECG test, the patient needs to visit hospital and wear some electrodes on the chest and measure ECG. But unfortunately, although the patient has abnormal heart rhythm, many times when the patient visits the hospital, the heart rhythm can be normal rather than abnormal rhythm can be shown. So that's the reason why a Holter monitoring device is being used. So in the case of Holter monitoring device, we can monitor the heart rhythm for extended period of time, such as 48 hours or 72 hours. So intermittent abnormal heart rhythm can be recorded, and therefore the medical doctor can diagnose the patient condition. But as you can see in the movie, the commercial Holter monitoring device is quite bulky and inconvenient. So in industry and the startup companies and in academia, there have been efforts to develop a flexible and very thin wearable device to measure electrophysiological data more efficiently. So and Biostamp, developed by MC10, is one example. Let's watch a movie.
Biostamp Research Connect, the first research system designed for the human body, offers the simplest solution for researchers to gather complex physiological data from multiple locations on the body. The Biostamp RC kit includes all of the tools.
Professor Kim, can you increase the volume a little bit? We cannot hear it.
Okay.
From the video, the sound of the video.
Type of physiological data to record. Activities and diaries, defined in the investigator portal, contextualize subject information by timestamping the beginning and ending of windows within the recording session. Once the study is defined, use the investigator tablet application to input subjects, assign sensors to subjects, start and stop recordings, and perform activities and diaries.
So as you can see, the Biostamp is much thinner and flexible. It based on the flexible electrode and flexible electronics technology, and it can measure ECG, EEG, and EMG depending on the location that the device is attached. And also, Biostamp has a wireless data transmission module, so the recorded data can be transferred to the mobile device and stored over a long-term period. Also, the recorded data can be uploaded to the cloud system, through the wireless network. And actually, Biostamp, this movie was made 2017, 7 years ago, and that device was improved and a new device called Advanced Neonatal Epidermal Device was developed by Zebra Science, another startup company. Actually, MC10 as well as Zebra Science was started by Professor John Rajas. So both company are based on the flexible electronic device technology from Rajas Group. Anyway, the device from Zebra Science could measure not just ECG, so electrophysiological signal, but also heart rate, respiratory rate, body temperature, body position, and activity. So basically, all the vital signs can be well recorded and monitored by using this device. So it seems that in terms of performance, these devices developed by startup companies looks very nice, but still there is a remaining challenge. The key remaining challenge is microscale non-conformal contacts in miniaturized electrodes. So if we take a look at the interface between the flexible device and the human skin, then since the human skin has these morphology, some wrinkles and rugged surface, although we make contact between the flexible device and the human skin, there can be some non-contacted region, these air gaps. And due to this air gap, of course, the contact impedance will be high. And if the contact impedance is high, then the signal-to-noise ratio in biosensing will be low. Also, if we want to do some feedback stimulation or feedback transfer drug delivery, these air gaps will decrease the efficacy of the feedback therapy. So those air gaps need to be removed. However, in the previous version, so if the electrode size is quite large, then although there are some non-contacted region air gaps, still the signal quality can be reasonable. So we can tell the important signals from the large electrode. But the problem is that if we want to do miniaturization of the electrode to make a multi-channel, and also multiple sensors integrated, then these air gaps in the case of small electrode, these air gaps can significantly affect the contact impedance, the signal-to-noise ratio, and as well as the feedback therapy efficacy. So how to solve that issue, how to remove these air gaps? The solution is to incorporate softer materials. Actually, flexible devices are typically made of plastic substrate and metal film or polymer, semiconducting polymers. But unfortunately, metal or silicon or semiconducting polymers or polyimide plastic substrate have the modulus of gigapascal range, which is much higher than the tissue modulus. So instead of this rigid electronic material, relatively high modulus electronic material, if we can use soft elastomer or hydrogel as an interfacing layer, then since the modulus is much lower than skin modulus, these hydrogels typically have tens of kilopascal modulus, which is lower than skin modulus. So these air gaps can be completely filled with the soft material. In addition, if we can add some conducting fillers to this soft material like hydrogel or elastomer, then the contact impedance, first of all, we can make very good conformal contact to the skin, so the contact area can be large. And by adding conducting filler, the conductivity can be increased and the intrinsic the impedance of the material can be decreased significantly. Therefore, eventually, the contact impedance can be significantly decreased. Therefore, the signal-to-noise ratio in biosensing, as well as the feedback therapy efficacy, can be improved. And this slide shows an example. In this case, we used flexible device first. We fabricated TCPO2 monitoring sensor and transdermal drug delivery device and the impedance sensor and the electrical simulation device on the plastic substrate. But if we use this flexible device only, and if we make a contact to the skin, then due to this rugged skin surface at the interface, there can be some microscale non-contact region which can be filled with air. And in that case, the signal quality can be quite low, and the feedback therapy efficacy can be low. Let me explain one by one. For example, if we want to measure transcutaneous oxygen concentration, typically we apply heat using heater here. Then by applying heat, oxygen molecule can be diffused out from the blood vessel, and transcutaneously it can be transported to the electrode, and we can electrochemically analyze local oxygen concentration. That's the concept. But if we have air gap, then the extracted oxygen will be mixed with the external air, so significant error will be involved. However, if we use hydrogel layer, ultra-thin hydrogel layer, first of all, hydrogel can make a very good conformal contact to this rough skin surface. Also, hydrogel contains water, and that water can exclude external air. Therefore, these extracted oxygen from the blood vessel can be transported through the watery, moisturized media, hydrogel, and then those oxygen molecules can be analyzed electrochemically by the TCPO2 sensor. So in that case, the signal quality and the error amount can be significantly improved. If we want to do transdermal drug delivery, typically we use iontophoresis. That means in 2 electrodes, we can apply electric field. Then due to the electric field, the charged drug ions can be transported following the watery media and then through the skin to the bloodstream. But if we have, of course, air gap, then charged drug molecules cannot be transported to the air gap, through the air gap. So the drug delivery efficiency, transdermal drug delivery efficacy can be significantly low. But by using the hydrogel layer, since the hydrogel contains water, so charged drug ions can be easily transported following the applied electric field. So the transdermal drug delivery efficiency can be significantly improved. Also, by adding conducting filler like PEDA-PSS conducting polymer, the ultra-thin hydrogel layer can have high conductivity and low impedance, and therefore the sensing quality of the impedance sensor and the stimulation quality efficacy of the electrical simulator can be improved significantly. So by simply adding very thin conductive, ultra-thin conductive hydrogel layer, all the sensing and the feedback therapy quality can be significantly improved. And more recently, we tried to improve the performance of the hydrogen interfacing layer. We tried to decrease the impedance further, and also we tried to increase the conductivity further, and also we tried to improve the adhesion property of the hydrogen interface further. Let me explain one by one. So previously, here in this case, previously we just used hydrogel mixed with PEDA-PSS. Of course, in comparison to bare hydrogel, this conducting hydrogel have higher conductivity and lower impedance, but still it can be better. It can be improved further. And our idea is to use polydoping. After mixing PEDA-PSS with polyacrylamide, if we use polydoping, then the PEDA-PSS chain will be loosened and connected to each other. And due to this doping effect, the conductivity, electrical conductivity can be significantly improved, and impedance, contact impedance can be significantly decreased. So several orders can be decreased. So by simply using polydoping, low impedance and high conductivity can be achieved. And more important thing is that as we increase the conductivity, or as we decrease the impedance by adding more and more conducting filler, adhesion between the hydrogel and metal electrode will become poor. Usually, the adhesion between the hydrogel and the skin can be easily made well, but we also need a good adhesion between the conducting hydrogel and the metal electrode layer. And in this case, to increase the adhesion property between the hydrogel interface and the metal electrode, we functionalize the surface with hydroxyl group and use some chemical TMS PMA to make the covalent bonding between the polyacrylamide layer and the hydroxyl group on the device surface. So in such a case, the conductive hydrogel interface could make very good adhesion to the electrode. So although the skin deforms, since we have good adhesion between the hydrogen and the metal electrode, as well as the hydrogen and the target tissue, skin tissue, a reliable signal can be achieved. And that is also very important to minimize the motion artifact. If we have the lamination, then a significant noise and the artifact can be made. But by guarantee a good adhesion between the hydrogel and metal electrode, as well as hydrogen and the skin, reliable, much better reliable sensing, much more reliable sensing could be achieved. So not just TCPO2 sensing and electrophysiological sensing, but also pH sensing and other biosensing could be done with high quality by using this material. It seems that as an interfacing layer, conductive hydrogel seems to be a very good option. But if we want to make high performance intrinsically stretchable wearable device, we need a better material. As an interfacing layer, although the conductivity is not very high, since the layer is very thin, the electron transport and the signal transport can be easy and facile. But if we want to make intrinsically stretchable wearable device, then not just sensor part, but also interconnection and all the materials should be intrinsically stretchable. Then that means all materials should be based on soft material like elastomer or hydrogel. That means the electrical performance of the soft material should be comparable to the conventional electronic material. And in the case of conductive hydrogel, the advantage is that its modulus is quite low. Therefore, it is a very good material for interfacing purpose, as I explained in the previous slide. But unfortunately, the typical conductivity of the conductive hydrogel is usually less than 100 Siemens per centimeter. Why? To increase the conductivity, we can add conducting filler like a conducting polymer or metal nanomaterial. But the problem is that hydrogels contain water molecule, and water molecules are polar. Therefore, they can trap electrons transported following the conducting filler. So due to this electron trapping, the signal transport can be significantly hindered, and that's the reason why the typical conductivity of a conductive hydrogel is less than 100 Siemens centimeter. But typical conductivity of metal, like silver or gold, is much higher, 600,000 Siemens per centimeter. So in comparison to metal, the conductivity of the conductive hydrogel is too low to make intrinsically stretchable wearable device. So in that case, we can think of another elastic material rather than hydrogel. We can think of elastomer, chemically cross-linked elastomer like a PDMS or Ecoplex, or physically cross-linked polymer like SCBS, thermoplastic elastomer like SCBS or SCBS. In the case of chemically cross-linked polymer like PDMS or Echoflex, the good thing is that since those elastomers are based on covalent bonding, material durability is really, really nice. Although we implant the PDMS in the body over a long-term period, its original mechanical property or material property can be maintained over a long-term period. So PDMS has been used as a implant for plastic surgery over a long-term period. But the problem is that we want to increase the conductivity. And good thing is that these elastomers doesn't have water molecule, which is different from hydrogel. Since it doesn't have water molecule, the electron can be transported easily following the percolation network of the conducting fillers. But in the case of chemically cross-linked polymers, for cross-linking, we need to use a platinum-based catalyst. So platinum-based catalyst can precede the cross-linking between the polymer chains of the PDMS. But the problem is that if we increase the loading amount of the conducting filler too much, then the catalyst doesn't work its role very well. So that means if we add too much conducting filler to PDMS or Echoplex, then rather than being solidified, the liquid state PDMS or Echoplex will remain as a liquid rather than being solidified because the platinum catalyst doesn't work its role. However, if we use thermoplastic elastomer, as far as we can apply enough heat to solidify it, although we maximize the loading amount of conducting filler like metal nano materials, still we can make solidified composite, stretchable conductive nano composite. So we can make a highly conductive and stretchable material. This slide shows an example. In this case, we used thermoplastic elastomer, SCBS, and SCBS was mixed with metal nanowire, silver core and gold shell, core shell type nanowire. The reason why we used the core shell type nanowire is because, first of all, silver provides the best conductivity among all metal. So to maximize the electrical performance of the stretchable conductor, we had better use a silver-based metal material, metal nanomaterial as a conducting filler because silver has very high conductivity. But the problem is that silver can be easily oxidized, as shown in this image, under biofluid, under sweat, under blood. Silver can be easily oxidized. And if the surface of the silver nanowire is oxidized, then the contact resistance between silver nanowires can be very high. So although silver nanowire itself has very low resistance, due to the high contact resistance, overall percolation network will have high resistance. That's the problem. Another problem is that inside the biofluid, silver nanowire can be dissolved. So silver ion can be leached out. And silver ions toxic. So that is a problem. There is a problem in biocompatibility. But these two issues, the oxidation issue and the silver ion leaching issue can be solved, can be prevented by using gold shell. So this is the cross-sectional data. So the diameter of the silver nanowire is around 120 nanometer. And if we add around the 30 nanometer thick gold shell, then first of all, by adding gold shell, the surface oxidation can be prevented. And since silver nanowire is not contacted with the biofluid, silver ion leaching can be prevented. So basically, the oxidation resistance as well as the biocompatibility can be achieved. And by using this nanowire, we made a stretchable elastomeric nanocomposite by mixing nanowires with SCBS. And by optimizing the curing temperature and the additive amount, we could make a composite which have the three-dimensional honeycomb-like microstructure. So these three-dimensional honeycomb-like microstructure serve like a spring. So it has a mechanical microstructure. So the stretchability can be enhanced more. So by using this nanocomposite, we can achieve 840% stretchability and 32,000 Gms per centimeter conductivity. For information, conventional typical conductivity of the conductive hydrogel is less than 100 Gms per centimeter. So this value is much higher, although still less than metal. And the stretchability is very high. Usually, the conductive hydrogels shows the stretchability of a 500%, something like that. But this value is much higher. But not very satisfactory. As I mentioned, we want to make high-performance intrinsically stretchable skin electronics. And in that case, we do not want to sacrifice the electrical performance of the device. So ideal material property can be like this. The stretchable conductor, stretchable conductive nanocomposite should have metal-like conductivity, high stretchability, and ultra-thin thickness, and the high resolution patterning capability. Let me explain one by one. First of all, the conductivity should be higher than 100,000 centimeter. Previously, we achieved 32,000, but that is not good enough to be claimed as metal-like. Conventional bulk metal shows very high conductivity. For example, silver and gold show 600,000 centimeter, and the bottom line of metal conductivity can be 100,000 centimeter. For example, iron or nickel show the conductivity around 100,000 centimeter. So if we want to claim that our stretchable conductor shows metal-like conductivity, then at least the conductivity should be 100,000 centimeter. So that is the bottom line. Also, we want to achieve high stretchability like 1,000%. Why do we need 1,000% stretchability? In the case of skin, usually the stretchability around 20%, and in the joint region, the stretchability can be 50% and 80%. Then why do we need 1,000%? That is related with material fatigue. For example, if the maximum stretchability is only 100%, and if we stretch the material 80% multiple times, like 1,000 times or 100,000 times, then since the maximum stretchability only 100%, if we stretch the material 80% multiple times, then fatigue will be accumulated inside the material. So if we stretch that material once, that may be fine. But if we stretch multiple times due to the fatigue accumulation, eventually mechanical failure will occur. However, if the maximum stretchability is 1,000%, and if we stretch the material 80%, only 80% multiple times, then the stretching amount 80% is much less than 1,000% maximum stretchability. Although we stretch the material multiple times, the fatigue accumulation can be minimized. That's the reason why we want to achieve very high stretchability. Ultra-thin thickness is important. If you take a look at the electronic device, a semiconductor device, and the cross-section, then typical thickness of the interdielectric layer or metal interconnection thickness is usually less than 1 micron. That means if we want to make vertically integrated multifunctional skin electronic device, then stretchable conductor thickness should be less than 1 micron. But if we use this kind of conductive rubber, then the conductive rubber or conductive hydrogel has high viscosity. So although we spin coat this material, the thickness of the stretchable conductor can be tens of micron. But we want to achieve some micron thickness. Lastly, we need high resolution patterning capability. That means we need to apply photolithography to pattern the material. But this rubbery material or conductive hydrogel are not very compatible with the photolithography because those nanowires are fully embedded in the polymer chain. So we need new material structure to apply photolithography and to pattern the material with high resolution. So it is very challenging to achieve all these requirements at the same time, but these requirements are needed as a stretchable conductor to make high performance intrinsically stretchable skin electronics. And to achieve that goal, we developed a new material, ultra-thin nanomembrane, by using modified version of the Langmuir-Blazid assembly method. So, Langmuir-Blazid assembly has been used over a long-term period in chemistry area. So, nanomaterials can be assembled as a monolayer on water surface by using nanomaterials with appropriate ligands, which is floating on water. But typically, the Langmuir-Blazid assembly process takes a long time. It's very slow. Also, even though we achieve a monolayer, very good monolayer assembly of nanomaterial, while we are transferring those assembled nanomaterial to the substrate, it can be wafer or plastic substrate. So anyway, while we are transferring those assembled nanomaterial to the external substrate, the assembly can be easily broken. And to solve that issue, in this case, we developed a modified version of the Langmuir-Blazid assembly. Not just using nanomaterials, but also we added toluene, organic solvent, and also SCBS solution. And also we controlled the molecular weight of ligands, PBP ligands, around the nanomaterial, in this case, nanowire. Then the nanowires can be assembled as a monolayer between water phase and oil phase. So on top, we will have toluene and SCBS. At the bottom, we will have water, and the nanomaterials will be at the interface as a monolayer. And if we wait a few minutes, then toluene naturally will evaporate. Then on the top surface, we will have a very thin SCBS layer. At the bottom, we will have water. And nanomaterials will be embedded in between. So if we take it out, the nanomembrane, then nanomaterials will be partially embedded inside the SCBS layer. So the original compact monolayer assembly can be well maintained while high stretchability or high conductivity can be achieved. Let's take a look at some microscopy images. This image shows the top view of the assembled nanowires. As you can see, metal nanowires are compactly contacted each other. As I mentioned, usually the intrinsic conductivity of silver nanowire is very, very high, but the problem is that the contact resistance can be high if the contact between nanowires is not good. But in this case, as you can see, nanowires, individual nanowires are well contacted to each other. So we have very large contact area. Therefore, contact resistance can be minimized. Therefore, metal-like conductivity, like 100,000 Siemens centimeter or 150,000 Siemens centimeter could be achieved. And if we take a look at the cross section, then the nanowires are partially embedded in the SCBS layer, very thin SCBS layer. If we zoom out this part, then this is the cross section, the nanowire partially embedded in the SCBS layer. And the nanowire thickness is around 140 nanometer, and the SCBS thickness is only 110 nanometer. So entire thickness of this nanomembrane is only 250 nanometers, so well below 1 micron. So ultra thin thickness stretchable conductor can be achieved. Another important thing is that nanowires are physically separated from rubber phase. Previously, here, nanowires randomly mixed with rubber. So as we increase the loading amount of the nanowire, the entire composite will become brittle, and the original elasticity will disappear. But in this case, nanowires are physically separated from rubber. So SCBS rubber can maintain its original elasticity. So original high stretchability over 1000% can be achieved. Another interesting is that nanowires are partially embedded in the water, in the SCBS rubber, but partially exposed to the air. So some part of the nanowire can be covered with a photoresist, and if we apply the wet etchant, then the exposed area can be wetched away. Therefore, photolithography can be achieved. Therefore, high resolution patterning can be applied in this case. So by using this ultra-thin nanomembrane, we can achieve all these requirements simultaneously. And by using this nanomembrane, we could develop multifunctional skin-like electronic device as shown in this image. We used multiple layers of nanomembrane. After making a nanomembrane, we patented it using photolithography. So we could fabricate electrophysical sensor array, like ECG sensor array, temperature sensor array, and the strain sensor array, and the humidity sensor array. Not just electrodes for the sensors, but also interconnection and the via structure could be made with the nanomembrane by using photolithography. The next issue is how to integrate these materials one by one, and to integrate these individually patterned nanomembranes, we used aligned transfer printing technique. So as a Rogers group developed the transfer print technique, and we used the exactly same process. We used mask aligner, contact mask aligner to align the align marks, and all the layers could be integrated one by one. So these 4 images shows the integration process from the bottom layer to the top layer. And although we integrated multiple layers, since each layer is only 250 nanometer, the entire layer thickness is still less than 5 micron. And since the stretchability is 1000%, it is very soft, so it could make very good conformal contact to skin, even wrinkled skin, as shown in this image, as well as this cross section. And due to this very good conformal contact to rough skin surface, contact impedance could be very low. So although we did not use any conductive gel, so basically, although our nanomembrane is a dry electrode, the contact impedance was comparable or even lower in some frequency region, so lower than the commercial wet electrode, which use the conductive gel. So due to this low contact impedance, we could record ECG data or EMG data with high quality. Also, by using this sensor, integrated sensor array, we could map strain distribution, temperature distribution, and the skin humidity distribution, etc. So basically, by using this one, intrinsically stretchable skin, like a BioTASIGN monitoring device, could be developed. So that's the end of the first part of monitoring, wearable type monitoring device. Let's shift our gear to the implantable device. Before going into more details, let me briefly explain the development process of the coronary heart disease. At each stage of the coronary heart disease, we can develop appropriate soft bioelectronic device. Usually, coronary heart disease begins with the occlusion, blockage of the blood vessel by the plaques. There are 2 important arteries on your heart, the left coronary artery and the right coronary artery. And when plaques are accumulated inside vessel, then due to the narrowed down blood vessel, blood supply will be decreased. And if the blood supply to cardiac muscle is decreased, then that can cause death of the cardiac muscle, ischemic cardiac injury. And if we have ischemic cardiac injury, that can cause myocardial infarction or arrhythmia, especially ventricular tachycardia can cause sudden cardiac death. Although the patient survives from arrhythmia or MI, eventually heart pumping capability will decrease down to 50% of the normal heart, which is called as a heart failure, and that will cause death of the patient. So to prevent the blockage, which is called as stenosis, we can use angioplasty. The balloon catheter can be inserted into this blocked artery region, and if the deflated balloon catheter is inflated, then the narrowed blood vessel can be increased. The diameter can be increased, so the blood flow will be restored. And to maintain the enlarged diameter, we typically deploy metal stent. And in this case, we can make biodegradable metal stand integrated biodegradable flow sensor and memory and wireless drug delivery module to prevent and monitor the restenosis of the treated area. But although we used angioplasty, the dead cardiac muscle cannot be restored. So still, the disease will be proceeded, and arrhythmia, ventricular tachycardia, or the heart failure will occur. And to prevent that, we can use interventional implantable devices. And today, due to the time limitation, I will just focus on the interventional treatment devices to prevent the sudden cardiac death or the cardiac death caused by the heart failure. So let me start with the heart failure case. This movie shows the transition from healthy heart to heart failure heart. For your information, heart failure is very fatal disease. So the 5-year survival rate is only 40%, less than 40%. That means within 5 years, more than 60% patient will die. And to increase the survival rate, what we can do, the only treatment method is heart transplantation. But the problem is that there are so many patients. There are so many patients who want receive heart donation, but there are not many people who can donate their heart. So the waiting list is so long. So many people usually doesn't have a chance to get a heart donation. So that's the reason why we are using implantable device. If we implant a device, and if we modulate the heart motion electrically or mechanically, then the expected lifetime can be increased. So for example, if the survival time can be increased from 3 years to 8 years or 10 years, then that patient will have much higher chance to receive heart donation. Then the heart failure, there's a high chance to treat the heart failure permanently. So that's the concept. That's the main purpose of the implantable device. By modulating the heart motion, we can increase the expected lifetime. Although we cannot permanently treat the heart failure with implantable device, at least we can increase the expected lifetime by using the implantable device. And that is important for heart failure. And this movie explains the transition from healthy heart to the heart failure heart. And in the case of healthy heart, the beating of the left and right ventricle is symmetrical. But the key difference of the heart failure heart is that left ventricle severely deformed. So the beating of left ventricle is not synchronized with the beating of the right ventricle. And because of that non-synchronized beating, the blood pumping pressure is significantly decreased. That's the main cause of the heart failure. And that can be managed, not permanently treated, managed by using implantable device. So typically, device is implanted around the chest region. This device contains electronics and battery, and the electrode is connected to the implanted device and inserted into the blood vessel. So following the blood vessel, the electrode reach the ventricle region. In the case of myocardial infarction or arrhythmia, single electrode can be used. But in the case of heart failure, we need to use 2 electrodes. So 1 electrode should go to the left ventricle, and the other electrode should go to the right ventricle. And if we stimulate these 2 points simultaneously, then the non-synchronized beating will become synchronized because the electrical stimulation. And theoretically, this biventricular pacing therapy should bring a lot of efficacy, but only 30% or 40% patients show efficacy, and the other patients do not show typical dramatic efficacy. And that's because in the case of a heart failure stage, already there are many dead cardiac muscle, and usually dead cardiac muscle show very slow conduction of the electrical signal in comparison to healthy cardiac muscle. So although we stimulate these 2 points, the stimulation signal cannot be spread through the entire epicardium due to the dead cardiomyocytes. The solution is to use multiple electrodes to stimulate multiple points in a programmed manner, but that is not possible because we cannot insert multiple tens of electrodes through this narrow blood vessel, and also these electrodes should pass through the cardiac valve. And if many electrodes pass through the cardiac valve, then cardiac valve will not be closed, so there can be another side effect. So by using conventional implantable device, this multi-point, multi-channel pacing cannot be achieved. Another approach to treat or to manage heart failure is to use mechanical therapy by using this cardiac mesh. This cardiac mesh is made of rubber, elastic rubber. So when heart expands, the electrodes will be stretched, and when heart compresses, the electrodes will apply pressure. So the blood pumping from left ventricle to the entire body, blood pumping will be increased. The blood pumping pressure will be increased due to this elastic cardiac mesh. This device showed good efficacy, but unfortunately, this device could not be approved by FDA. Actually, this device was developed by a US startup company. But the reason why they could not get approval from FDA is because this device needs open chest surgery rather than minimally invasive procedure. So FDA thought that although this device showed some efficacy, if the patient needs to do open chest surgery, then the cost and the time for recovery is too long and the cost is too high. So the benefit may not be high enough in comparison to the cost that the patient needs to pay. So this device could not be approved. And our idea was to combine these two, so electrical therapy as well as the mechanical therapy by using conductive cardiac mesh. So we thought about development of similar cardiac mesh, but rather than using insulative rubber, conventional rubber, we try to use a conductive rubber. And if we can make multiple channels, then we can stimulate all these multiple areas on the ventricle region. So multi-channel programmed stimulation can be possible. Also, since the conductive rubber is elastic, stretchable, so it can assist the blood pumping when heart contracts. So both electrical stimulation and the mechanical stimulation can be electrical stimulation therapy as well as mechanical therapy can be achieved. Also, multi-channel cardiac modulation can be achieved. The concept was very good, but the problem at first stage was in the material. We first tried to use the commercial conductive rubber, but the commercial conductive rubbers made by Japanese companies or German companies show the conductivity was too low. The maximum conductivity was 100 joules per centimeter. As I explained, typical metal conductivity is very high, at least higher than 100,000 joules per centimeter. And if the conductivity is too low, then we have two problems, large power consumption and high contact impedance. Already, although we use the conventional metal electrode, the patient needs to do surgery every 7 years to replace the battery. The patient need to pay a lot of money to replace the entire module to replace the battery. But if the resistance is too high and if the power consumption is high, then the patient needs to do replacement surgery more often, which doesn't make sense. More serious issue is in contact impedance. If the resistance is high, that means the contact impedance will be also high. And if the contact impedance is high, then when we want to inject electric current into the cardiac tissue, we have to apply high voltage because of the high contact impedance, high contact AC resistance. And that will cause more power consumption, very large power consumption, as well as that will cause the electrical stimulation fatigue accumulation. So both are very bad situation. So to solve that issue, we had to develop material first. So that's the reason why we utilized the stretchable, high performance stretchable conductive rubber, silver nanowire, and SCBS nanocomposite. So by using that, we fabricated cardiac mesh and applied that in animal model, small animal model, rat model, post myocardial infarction model. So if you take a look at this movie, at first, the heart rhythm was irregular. But after applying the global resynchronization therapy, bioventricular pacing, the heart rhythm became normal. And not just electrical stimulation, but also apply the mechanical therapy. We control the modulus of the material device. So we resected the epicardium, heart wall, and measured the strain stress curve of the epicardium and controlled the modulus of the cardiac mesh to be same with the heart muscle. So by matching the modulus of the device, it doesn't interfere expansion of heart, but when heart contracts, it can assist the contraction, so the blood pumping pressure can be increased. And due to the bioventricular pacing, the QRS duration could be significantly decreased. That means if the left ventricle and right ventricle beat at a different time, the time duration for QRS peak can be increased because the left and right side will, the EKG signal will be averaged. But if the beating of left and right ventricle are synchronized, then the time duration for entire QRS peak can be significantly decreased. That shows the synchronization could be achieved, and because of the synchronization, the blood pumping pressure could be improved. And later, we fabricated a larger device, a multi-channel larger device for optimized, customized for pig model, swine model. In this case, we had 84 electrodes, but since we were interested in local ECG monitoring and local stimulation, we paired the two channels into two electrodes into one channel. So in total, we had 42 channels that could wrap around the heart surface. So on the peak heart, we could measure local EKG, and by measuring the local EKG, we could see the healthy part and the diseased part. Typically, diseased part of the heart shows the late delayed conduction. So by making an activation map, late activation part corresponds to the diseased part of the heart. So after figuring out the diseased part of the heart, we can customize the electrical stimulation using this multi-channel cardiac mesh. So by applying programmed stimulation, the blood pumping capability can be maximized, and the expected lifetime can be increased further. So by using this device, actually, the expected lifetime can be potentially increased a lot. Then the patient will have a much higher chance to receive the heart donation. I mentioned that low impedance is very important, and in the material-wise, we can make decrease the impedance further, and the corrosion resistivity increase the corrosion resistivity further. So previously, we used the silver core and gold shell nanowire, but by simply adding platinum shell, the impedance can be even lower, and the platinum has very high corrosion resistance in comparison to silver and gold. So over long-term period implantation, platinum maintain its original low impedance and original electrical property. So by simply changing the material from core shell nanowire to core shell nanowire, the contact impedance could be increased. Therefore, signal-to-noise ratio and sensing could be increased, and electrical stimulation efficacy could be improved. The same device can be also used arrhythmia. So I talked about myocardial infarction and arrhythmia, and then heart failure. And I looked at the heart failure case first. But the same multi-channel cardiac mesh can be also used arrhythmia, especially ventricular tachycardia. So ventricular tachycardia is one of the arrhythmias, and the ventricular tachycardia is very fatal, so it can cause a sudden cardiac death. Let's watch a movie to understand the ventricular tachycardia a little bit more.
Tachycardia refers to a fast heart rate. Typically, a faster tachycardic heart rate is considered anything above 100 beats per minute. But ventricular tachycardia is different than, say, a fast heart rate from exercising, which is called sinus tachycardia. Normally, the electrical signals that generate each heartbeat starts in the right atrium at the sinus node, also known as the sinoatrial node or the SA node. If the rate goes above 100 beats per minute and originates in the SA node, it'd be considered sinus tachycardia, which is totally normal. Sometimes, though, heartbeats can become abnormal if that electrical signal doesn't start in the SA node and starts in the ventricles instead. Premature ventricular contractions, or PVCs, are single beats originating from the lower chambers. Anytime there are more than 3 beats like this in a row, then it's defined as ventricular tachycardia. Ventricular tachycardia, sometimes called VTAC or VT, can cause the heart rate to go above 100 beats per minute, which can be extremely dangerous and lead to sudden cardiac death. But hold on, how can that happen? It's not like when we're exercising, we're risking sudden cardiac death, right? Well, even though we say tachycardia is anything above 100 beats per minute, most patients with ventricular tachycardia experience heart rates as high as 250 beats per minute. 250 beats per minute means the heart rate's beating over 4 times per second. And when the chambers are pumping that fast, they don't have enough time to even fill with blood. So the heart is furiously pumping out just tablespoons of blood to your body, and most importantly, your brain, which is just not enough. If this happens, a person can have symptoms of not having enough perfusion to their tissues, like chest pain, fainting, dizziness, or shortness of breath. It could even cause sudden death.
So basically, ventricular tachycardia is a really fast beating of the ventricle, especially left ventricle, and that can cause sudden cardiac death. So that is very fatal disease. So to prevent a sudden cardiac death, so typically implantable device is being used. So again, the device will be implanted around the chest region, and electrode will be connected to the implanted device and inserted into the blood vessel to reach the right ventricle. And when ventricular tachycardia occurs, if this continues, then the patient will die. So this device, this electrode detects VT and apply huge electrical shock. Very large current will be applied here. And that huge current will spread through the entire heart because the current is very high. All the current will spread through the entire heart and will startle the cardiac muscle. And then after electrical shock, the normal heart rhythm will be restored. So this implantable device and electrical shock is very important to prevent sudden cardiac death. But the problem is that it has some side effects. First of all, this electrical shock is very painful. So the patient, if once experienced this electrical shock, the patient never doesn't want to experience that once again. Also, due to high electrical shock, it can cause myocardial damage. More importantly, usually subsequent arrhythmia occurs. That means, although the patient survived using this device from the sudden cardiac death, another ventricular tachycardia will occur. That means another chance of sudden cardiac death will be accompanied in that patient. And these side effects have been known for tens of years in cardiology area. So medical doctors tried a lot to solve the issue. For example, in 1988, almost 25 years in Circulation, which is the prestigious journal in cardiology, there is one report about soft threshold stimulation. Without using electrical shock, by using subthreshold stimulation, the ventricular tachycardia could be removed. Let me explain the concept of the subthreshold stimulation first. There is a threshold voltage to modulate the beating of the heart. If the voltage of the electrical stimulation is higher than this threshold voltage, then we can modulate the heart motion. Of course, capture pacing should use higher voltage, and electrical shock should use much higher voltage than threshold voltage. But sub-threshold voltage stimulation means the voltage should be lower than threshold voltage. That means although we apply stimulation, and although a very small current flows, the natural motion will be maintained rather than modulated. And that small current can remove VT. And since the current is very, very small, chest pain, myocardial damage can be prevented. But unfortunately, subthreshold stimulation could not be commercialized. Why? Usually VT occurs on the left ventricle, but the electrode is on the right side. And if the current is very high due to when we apply the electrical shock, then the large current can spread into the entire heart region. But if the subthreshold stimulation applies a tiny, tiny current, then the current level is too low, too small. It remains only local region. That means with single electrodes, there is no way to apply subthreshold stimulation, especially for left ventricle region. But if we have multi-channel device, since we have multiple channels on the entire ventricle region, entire epicardium, we can use subthreshold stimulation. So by using our soft multi-channel cardiac mesh, we try to apply subthreshold stimulation to the rabbit model, and almost 65% of the VT could be removed without DC shock. But more interesting result in the prevention. In comparison to control case, if we apply a subthreshold stimulation, then subsequent arrhythmia inducibility could be decreased almost 1/3. Previously, in the control case, almost 80% cases, we could see recurred arrhythmia. But if we apply subthreshold stimulation, that could be decreased below 30%. So dramatic effect in terms of prevention of the subsequent arrhythmia. That is very important. We find out this effect only in rabbit model, not pig model. So we probably need further research in large animal model, but it is also true that that subthreshold stimulation using multi-channel cardiac mesh has a high potential. So it is true that there is a good advantage, however, and promising, but still also there are many remaining challenges. We need better resolution, high resolution, multi-electrode array fabrication, and also in the body, under in vivo condition, the device should maintain its original performance over a long-term period. We need more larger animal experiments, and also advanced wireless power transfer supply is needed. More than anything else, we need AI-assisted data analysis. If I talk about AI-assisted data analysis and therapy stimulation, feedback therapy stimulation, in the case of single channel, it is easy to analyze the data, and also it is easy to decide which kind of stimulation should be applied. But if we have multiple channels, for example, 100 channels, then we need to analyze data from 100 channels at the same time. And in real time, we need to decide which programmed stimulation should be applied through the 100 channels. That is very difficult. So in that case, we can get assist from AI. Then much more efficient operation of this multi-channel software device can be achieved. Another issue is in power transfer. As I mentioned, although we use a single electrode, the patient needs to do surgery every 7 years to replace the battery. That means if the patient implant a device at the age of 30, then he or she may need almost 10 times of surgeries. And we are talking about continuous stimulation using soft tissue stimulation. And usually, in comparison to recording, stimulation requires a lot of power. So power consumption will be much, much higher than conventional single-channel electrode. Therefore, simply relying on battery is not a very probable solution. So we are thinking to use wireless power transfer. But the problem is that the conventional wireless power transfer, such as inductive coupling, has very narrow displacement range. In other words, for example, if you want to charge the smartphone on the wireless charger, and if there is a little bit of displacement in the X or Y direction or Z direction, then the charging efficiency will be significantly decreased. For example, if we use inductive coupling, the wireless power transfer can be reliable only inside several millimeter range. But we are talking about wireless power transfer from the skin to the heart surface. The heart is deep inside, and heart is continuously moving. And also, heart has a spherical shape. So reliable power transfer from the skin to the heart surface is really challenging. So rather than using conventional inductive coupling, we can use paradigm symmetry-based.
Professor Kim, I'm sorry to stop you, but can you wrap up a little bit with a little bit more speed?
Yeah,
So we are a
3
little
minutes.
bit out of. I'm so sorry to stop you. So
yeah, I'm sorry. Yeah, I'll finish within 3 minutes. So by using paradigm symmetry, the reliable power transfer range can be increased 10 times, 30 millimeter, and also if we integrate ultra-thin battery, a thin film battery, in this case, all layers are made of inorganic thin films, and that device can be flexible, very thin, and also by adding pattern, we can make it stretchable. So intrinsically stretchable device can be integrated with this flexible or stretchable thin film battery. And if we use a PT symmetric wireless power transfer combined with this ultra-thin inorganic battery, then reliable power transfer and continuous charging of a deformable battery. And also, although it is deformable, since it doesn't require liquid type electrode, the safety would be guaranteed. So for implantable system, long range power transfer and thin film battery combination can be a very good option to solve the power transfer issue. So today, I talked about nanomaterials-based software electronics, mostly materials and the sensors and substrate, and a little bit about the AI or wireless power transfer. But in the future, we need to work on the other parts further toward the system level integration. Then eventually, we will be able to translate our device to the clinical field and to help the suffering patients. That's the end of my talk. Thank you for your attention.
thank you so much. I wish we could have a little bit more time, but I'm sorry I have to stop you. So
I'm sorry, I could not control my time.
it's
I talked
okay.
too much.
It's all informative, so okay. So let me introduce our panelists so that we can continue our panel discussion and then a Q&A session. So please welcome Professor Xing Xiong on the stage from Tsinghua University. If I may introduce him a little bit briefly, he got his bachelor's from Tsinghua University. He had his PhD at MIT and postdoc from UIUC, and then he came back to Tsinghua University as now he's an associate professor. And then now I'd like to introduce our rising star, Professor Yu-Ching Chung from Peking University. And I heard from Professor Haixia Zhang that Yu-Ching is a famous star already at Peking University. She got his bachelor's and PhD from Peking University, and she did her postdoc from Professor Jenan Bao's group at Stanford University, and she published the papers including science and advanced materials. And you have to know this, she was named as the MIT Technology Review's TR35 China list in 2022. So let's welcome our panelists and our amazing speaker, Professor Kim, again on the stage. So hello, everybody. Professor Kim,
Yeah,
would you like
yeah.
to start? Yes.
Yeah, sure. Thanks very much for Professor Dae-Hyeong for your wonderful talk. I have two questions. The first one is pretty specific about the first work about the hydrogel.
Okay.
It shows great conformability and great contact impedance. But how about the long-term use of that hydrogel? Because hydrogel always faces with some dehydration issues that would finally degrade its performance. And would you please briefly introduce the long-term use or stability of that hydrogel? Thank you.
Yeah. Thank you. Thank you for the good question. Since it is on the skin surface, the material durability may not be a matter, but dehydration, of course,